Hi, today is World Diabetes Day and I want to talk to you about the differences between type 1 and type 2. So I have a lot of people that will come in and they'll go, I've got diabetes and I take insulin. And I'll say, so which type are you? And they're like, well, I'm on insulin. Okay, so which type are you? Well, I take insulin, so clearly I'm type 2. Okay, my love, not a problem, you're type 2, so we can work with that. And they assume because they take insulin, that just means that they're the insulin type of diabetes, which is not the same at all. Type 1 and type 2 are very, very different styles. The other aspect is I have people coming in who say, I've got diabetes and I was cured of it because I changed my diet. And then if they're talking to somebody with type 1 diabetes, they're going, I wish I could do that. And they do. They go, I wish I could do that. I wish I could just change my diet and my diabetes is cured. And not everybody who has got a bad diet will get type 2 diabetes, but there is a larger proportion of people with poor diets and who have more problems with metabolic disorders and overweight that will end up with the difficulties with type 2. That is a fact. But that's not the case with type 1. In fact, type 1 a lot of the time develops in early childhood, and those children are not overweight at all. And a lot of times they're quite underweight, to be fair. So what is the difference between them then? Well, it's because of how they actually process sugars in your body. How do I explain? Type 1, your pancreas doesn't make insulin at all. It does, but in too lower levels. And then the body's immune system starts attacking cells within the pancreas, making the insulin. Where in type 2, the pancreas makes less insulin than it used to. But your body becomes resistant to the insulin. So it's not attacking the pancreas, it's just ignoring the insulin you're giving it. And that means the body has lots of insulin and it's not able to use it, not effectively. And therefore the body creates other problems because there's too much in there. So type 1 is actually an autoimmune disease, whereas type 2 is much more affecting older people, obesity and genetics, as we discussed. So what are the symptoms? Well, interestingly, the symptoms for both types are the same, near enough. They can have problems with tiredness, muscle loss problems. Sometimes they can lose weight, extreme thirst, extreme hunger, fatigue, blurry vision, irritability, headaches, increased urination. They may find that they have thrush more. Because they're constantly urinating, they feel like they've got thrush. Problems with the teeth, with the gums, itching, their skin quite itchy and dry. Men may have problems with erectile function. They may get numbness and tingling in the hands and feet, peripheral neuropathy. And then they struggle with infections because, again, their body is not coping well. So it's common for them to have all of these. Can acupuncture help? With type 2, it can make a difference. With type 1, no. And interestingly, we do request, if you are type 1 diabetic, that you monitor your glucose levels because acupuncture lowers blood glucose and insulin levels in the body, which in type 1 can be dangerous. Go learn some more about diabetes. It's a very interesting condition. And if you're struggling with the symptoms, the peripheral neuropathy, then acupuncture can help. This has been Thoughts with Points. Take care.